in talking with Gominda, I understand that that's not what you're interested in today, so I won't go into many of those methods, okay? But what I will do are talk about the absolute methods. And I'll start out talking mainly about multiple choice questions, but then at the end, we'll talk about how these apply to clinical exams. For lots of the methods, it's pretty straightforward, but there are one or two methods. One method I'll mention in particular, the borderline group method, is designed specifically for clinical examinations, OSCEs in particular. So that's the plan for the next little bit. Again, I would encourage you to please ask questions along the way, to stop me when I'm not making sense, or if you have questions about what it is I'm talking about, okay? So let's start with Angoff's method, because it's probably one of the best known methods around. Basically, the process consists of selecting a group of judges, and how you select the judges is important. They need to be of sufficient number, and they need to be credible, and they need to understand the content area, and they also need to understand the examinees, and they need to be acquainted with the purpose of the test. So one of the most important things you can do in any of these standard setting methods is to choose the judges appropriately. That's where the credibility of this process is going to reside. It's in the people who set the standards. So I would encourage you to spend a lot of time thinking about who's setting standards, a lot less time on what method you choose, because the methods don't really, as you'll see as this unfolds, aren't really going to matter very much. It's mostly a matter of convenience and credibility. So in Angoff's method, what you do is you select the judges, ideally a group of at least 5 or 6 or 7 or 8, depending on the stakes of the examination. Higher the stakes, more judges are better. And you have a discussion with the judges. You talk about the purpose of the test. You talk about the nature of the examinees. You talk about what constitutes adequate and inadequate knowledge. So the idea is that this would occur in the beginning of the session, maybe 15, 20 minutes. Doesn't have to be tremendously extensive, especially if you've chosen the judges appropriately, because they're going to understand all of these things. The key is that the group is going to spend a little bit more time than that talking about a borderline group. And one way to think about a borderline group, and what I've often asked the judges to do when working in the Angoff method, is to ask them to think about 100 students they've had. And some of those students are going to be clearly qualified. And I ask them to forget about those clearly qualified students. And then I ask them to think about some that are clearly unqualified, clearly don't meet standards, and I ask them to forget about those. What's left is the borderline group, and that's the group that you care about. So if you apply this to an MCQ exam, and we'll talk about how to apply it to an OSCE in a little bit, the idea is that you read the first item out loud, and you go around the room, and you ask each of the judges to estimate the proportion of the borderline group that would respond correctly. At the end of that, you record those ratings somehow so that everybody can see it, and you give everybody the opportunity to change their minds. And then you repeat this for every item on the exam, and you come up with a standard. So this is a hypothetical example of an Angoff with 5 judges and 5 items. So what you can see is at the top, the judges are 1 through 5, and each estimate that they provided is indicated in the block. So that when you started with the first item, the first judge said 60% or 6/10 of his or her borderline group should get the item right. Judge 2 said 70%, Judge 3 said 55, and so on. You put them up on the board, the judges have the opportunity to talk about it, they get to change whenever they want, and you do that for all the items on the exam. When it gets time, to set the cutting score when you're all done, what you do is you generate an average for each item. And you can see that under the heading of mean at the end. And then you add those up. And they'll end up being on the same scale as the raw scores for the examination. So in this particular hypothetical example, 3.65 was the cutting score. And that means that anybody with a score of 1, 2, or 3 on this little exam would have failed, and anybody with a score of 4 or 5 would have passed. The only other thing I'll point out as you go through this is that sometimes the judges, one judge may be different, significantly different from the other judges. And that's absolutely fine. You ask them to have a conversation. Ideally, or sometimes what I've done is asked the judge with the highest estimate to give their reasons for that judgment, ask the judge with the lowest to give their reasons for that lowest estimate, and then have a conversation about it. And if they're happy with where they are, then it's okay. So if you look at item 3, you'll see that at the end of the day, there was one judge who thought that only 40% of the borderline group would get it right. Another judge thought 80%. And they were convinced that that was the correct thing to do. And they were certainly allowed to hold their opinions. So the idea is to give everybody the opportunity to have a conversation. And then at the end of the day, to make some decisions. Before I go on, I just want to stop here and ask if anybody has any questions about the Angoff method. You can either type them into the chat or speak up.
John, I didn't, Aloka here again. I didn't understand the rationale of saying 1, 2 would fail and 4 and 5 would pass. That is like is it the total score of the exam, or how did you get that figure?
The 3.65?
Yes. So that is the mean. That is the proportion of students that the 5 judges thought would pass from the borderline group. So is that the pass mark, or so what is the total mark that this 5 questions would give them?
So this has got nothing to do, there's no, in this table, there is no data based on student performance.
Mm-hmm.
Okay, so this is wholly what the judges came up with. And so basically what you're saying is that on average, the borderline group would get a 3.65 on this exam. Obviously, it's a 5-item exam. They're only going to get 3 or 4. Go ahead.
That maximum that these 5 items would get anybody would be 5 marks. So 1
yes.
for 1 mark. That's what I wanted to clarify. Thanks.
Yeah, I'm sorry. Yes, the maximum on the exam would have been 5. They could have had anywhere from 0 to 5 on the exam.
Okay, right. Thank you. I got it.
Great. Other questions?
I think there is one hand raised. So Shamini, you can speak up.
Yeah.
Actually,
can we come to a conclusion about item 4, whether it's sort of a good item or not at this point also?
I wouldn't make any judgments about the items on this. So if you look at item 4, this was an item that the judges thought was a little bit harder.
Okay.
For the borderline group. So what they did is they gave it a little bit of a lower rating. Item 2, for example, they thought was very easy. And so they gave it a higher rating, a higher evaluation.
Okay, thank you.
Sure.
I think Ashwini, your hand is raised, and Madhuri.
Hello, Ashwini here. My question is regarding item 3, where there's a clear difference between judge number 5 and the other judges. Is there any place for them to, at this point, discuss and resolve?
Yes.
Okay.
Yes, absolutely. What ought to be happening is that for item 1, you go around the room. Let's take item 3. So you go around the room. Judge 1 said 70% of the borderline group should get this right. Judge 2 said 75%, Judge 3 said 80, Judge 4 said 75, Judge 5 said 40. At that point, you have to have a conversation with the group. So one way to manage the conversation is to ask Judge 3 to talk about why they chose 80, and Judge 5 to ask about why they chose 40. And everybody is free to change their mind at any point in time. So I've been in instances where after a little bit of conversation, the judges sort of change their estimates, they come closer together. But I've run into other situations where the judges end at the end of the day say, no, this is what I think, and it stays where it is. So everybody gets a voice.
Thank you.
Sure.
Mother.
John, what is the impact of number of panelists in the panel in the number of judges on the outcome? Is there an ideal number or more the better?
So, yeah, that's a really good question. It is just like items on a test. So the more items on a test you have, the more reliable the final result is. It's exactly the same here. The more judges you have, the more reliable the results are. So one of the things you can think about doing when you do this kind of work is to calculate a reliability or a standard, or better yet, a standard error of the mean, and take a look at it and decide whether it's at a tolerable level. So with 1 or 2 judges, chances are it's not going to be very reliable. By the time you get up to probably usually 8, 10, 12 judges, it's going to be very reliable, and you're probably not going to get a lot more reliability by adding more judges. So it's in that range is typical. But what I would encourage you to do is when you collect the data to actually calculate the reliability, or better yet, standard error of the mean, and let that be your guide as to how many judges you use.
Thank you, John.
Sure.
Mahinda.
Yes, John, I have a question.
Yeah.
When we define the process, can we make some sort of can we define the narrow range that only within that range all the panelists should score, or variation should be minimum or something like that? Can we define before the process?
You can, but I probably wouldn't do that. I'll tell you why. At the end of the day, the credibility of this cutting score is going to rest on the people who actually set the standard. And as a consequence, if you then undermine, in a sense, what they're going to tell you by giving them ranges, by throwing out some of their evaluations, I think you undermine the results of the process. In my experience, one of the things people sometimes do with these data are that they go through each item and they throw out the judge with the highest rating and the lowest rating. I'm not so sure that's a very reasonable thing to be doing. You end up getting back to basically the same result. And at the end of the day, when you go to defend this standard for students and other users of the data, you basically have to explain something that doesn't make much difference at the end of the day. So I would encourage you to not tamper with the data once it's put together, once it's been provided to you. And I would rely on the judges and their conversation to bring people closer together.
Prof. Joe?
Yes, John, now I have 2 questions.
Yeah.
One is regarding giving this rating. Is it you are giving it as a group so that the other person knows what is the grade which has been given by another person, or you are giving it individually and then the person who is facilitating add up and give the comments? Is it individually, or the entire group knows what is the mark which is, or the rating which has been given? That is
So,
question.
okay, let me do
And-
that one and then ask me the next
Yeah,
question.
yeah, sure, John. Yeah.
So what I usually do is I have a big blackboard or a whiteboard or something to write on. And when this is being run, I ask Judge 1 what their rating is, and I write it on the blackboard so everybody can see it. And I do that for the second and the third and the fourth and the fifth item. So everybody sees what everybody else puts up, and then they have a conversation with everybody being free to change their minds. The only other thing I do sometimes is I don't start with the same person all the time. So for the first item in this little example you see here, the first item, I would ask the first judge to provide the first estimate. For the second item, I'd ask the second judge to do that, just so that we don't get into, just so you don't get into any sort of one person having more influence than someone else, given their initial rating.
Okay. So thank you, Prof. The second question is now the panel of judges, should it be always content experts?
So they have to be at some level. They have to be knowledgeable about the content. So if they're not knowledgeable about the content, I don't think they're particularly useful in this setting. So if this were, for example, a test about cardiology, I would want to basically have cardiologists in the room. If this is general internal medicine, I'd like to have a mix of generalists in the room. So that it's content dependent. However, if this is a test about communication skills, for example, or professionalism, I might include other people who are patients, perhaps, folks who have content expertise, and patients would have content expertise in terms of communication skills. So you have to know what you're talking about when you're in here. Okay?
Yeah. Now, why I asked that question is now in some of the Sri Lankan universities, they are moving towards integrated assessment. So when there's an integrated assessment, for example, now with the basic science, in the panel of judges, there may be anatomists, there may be physiologists, and there may be biochemists, pathologists, microbiologists. So they are content experts in their own field. But how are they going to judge or give the rating of a discipline on which they are not content experts?
So let me tell you about a study we did. We were worried about exactly that problem. And so we were working with internal medicine exams, and we had a group that was it was a general internal medicine exam. We had a group that included cardiologists, gastroenterologists, all the specialties of medicine. And so at the end of the day, we could not find any difference between them, even on questions in their content area. So what happens is the group, as it works together, tends to reach an agreement, and everybody takes a different perspective. So it wasn't bad to have the perspective of a generalist on a patient with chest pain, in addition to the perspective of a cardiologist. So all of those things are really good things and depend on how you select folks. The other thing I would suggest, and has been done many times with Angoff method, is that if this is done after the examination is given, you should feel free to include the performance of examinees in the process. So for example, the p-values, the percent of examinees that got each item correct. Incorporate that, allow the judges to use that information as they reach their decisions about what they're doing. So that's a second strategy, especially in the setting you're talking about where not everybody's an expert.
Okay. Thank you very much, Prof.
Sure, no problem. No more questions? And we will move along to Ebel's method. And this is in many ways a variation on Angoff's method, slightly different setup. But again, you select the judges, talk about the purpose of the test, you define the borderline group. But unlike the Angos method, you build a classification table for the items. And let me skip through. Let's look at, I think it's easier to look at the table than it is to try and present this abstractly. So in the first column, you see category. And what this group of judges decided to do before the test was given is to take each item and put it in a category. And they decided that they wanted 3 categories. One set of categories related to how important the content was. So they divided items in terms of whether they were essential, important, or acceptable, thinking that that would influence the estimates of the judges. They also, within each category, decided that it was important to think about whether the items were easy or hard. That also would influence their judgment. So what they did is they categorized as a first step in the process all the items in the test into these categories. They then went to a particular category, like essential and easy, and they asked the Angoff questions. So they asked, what proportion of a borderline group do you think would get the easy essential items right? And then they went around the room just as the Angoff method was done. Everybody puts their estimates up. There's conversation. Everybody's free to change their judgments. And then they move on to the second category, essential and hard. And they do exactly the same thing. They go around the room and everybody makes individual judgments about that. At the end of the day, they average it for the category. So as you can see in this example, the group of judges thought that for the essential easy items, 95% of the borderline group would be getting those items right. But they'd only be getting 80% of the essential but hard items right, and so on down the line. So when it got down to the items that were acceptable, they found that they thought that the borderline group would get 80% of the easy items right, 50% of the hard items. So that's the process. In order to turn that into a cutting score, you count the number of questions in each of the categories. So in this little examination, the hypothetical examination, there were 17 items. The judges categorized 3 of those 17 items into the essential and easy category, 2 into the essential and hard category, and so on down that third column to total 17 questions. And to get the cutting score, again, it's just like Angoff. You take the proportion right, the borderline group performance, you multiply it by the number of questions and you get a score, and you simply sum those scores to get a cutting score for the test. So in this little hypothetical examination, at the end of the day, the judges thought if you got a score, the scores ranged from 0 to 17. If you got a score under 12, you failed. If you got a score of 13 and better, you passed. Okay? So why don't I stop there and ask about questions for this method? Nobody has any questions?
Aloka here. Now, in this method, John, the judges have to categorize the questions into easy, hard, under these 3 categories. So there will also be a difference of opinion about each item being essential, important, easy, or hard, isn't it? So that has to be decided earlier.
Yes, they have to reach consensus on that.
Yeah. Okay.
So that they don't get to change their opinion. So this is a consensus statement at first.
Thank you.
Sure.
Hello, this is Shehan Silva speaking. I have a question. can there be an overlap where, for instance, if can there be one question which could be an essential and easy in as a category, which could also overlap as an important and easy one at the same time? Does it always have to be, does it always have to be in one category?
Yes, it does, because the items can only be counted once. So yes, it does need to be in one category. So one category and one category alone. And if you look at these, all essential items are also important and acceptable, but they're essential. And so that's the level at which the item is categorized. The other thing to keep in mind is that this is an example in terms of categories, and you can make up whatever categories you want in this method. There's nothing about this that is set in concrete or set in stone. So if you didn't like the distinction between easy and hard, you could just categorize items into essential, important, and acceptable. Or maybe you want to have highly indicated, indicated, and neither highly indicated nor contraindicated. So you can make up categories that make sense given whatever it is the purpose of the test is and whatever makes sense in your context. The other thing I would point out about this is once you've done this once and you have a proportion right, a borderline for the categories, you don't need to do this every time you do an exam. All you'll need to do is categorize the items, and then the proportion right borderline number applies to those. So what you're doing is you're making a judgment about a whole category of items, and you don't need to make that judgment every time you do the test. Does that make sense? Other questions?
Is this one easier, or is it why was this method chosen over NCOF, or what is the advantage of this? Will you compare with NCOF method?
So this takes a little less time because once you do it, you've got it forever. Okay, you don't need to do the borderline group, what proportion of the borderline group question every time you do a test. All you have to do are categorize the items. So it's much more efficient than NCOF is in that way.
Thank you.
John, this is Gominda. Just for the benefit of everybody, can you express your opinion about this dividing the number of questions based on item analysis results, the p-value item analysis?
You could do that again.
Hard.
Yeah, you could certainly stratify, make the easy and hard decisions based on the performance of examinees. Absolutely. You don't have to have for the first go around or even the second go around. I mean, you could do this anytime you wanted in any way you want. So the idea is that this is a very flexible method, and the categories you choose, how you sort items into categories, all of those things are really up to you.
Thank you.
Anyone else? Okay. So do you use item response theory for any of your examinations?
No, John, but go ahead, please.
Well, no, I mean, I wasn't going to do this if you don't use item response theory. This method isn't something that you need to use or know about at this point. Be happy to go through it. On the other hand, if you're not using it, then I don't want to take up your time when we could be talking about other stuff.
I think you can in passing mention, but
Okay.
I don't think that we'll be using it, but certainly you can mention.
Okay, well, I'll do it very briefly then. If you do item response theory, this is sort of set up the same way. You select the judges and they have a conversation, and you define the borderline group. All that's important. But what you do is you give each judge a book of the questions on the exam, all the questions on the exam, and they're sorted in order. So the book of items, one page, one item, each page, is sorted from the easiest to the hardest, depending on the performance of the examinees. So you use the IRT version of item difficulty to do that. And basically all you do is you ask the judges to read each question and to stop at the point where they think there's a difference between competence and non-competence. So basically what you're asking them to do, you've created this book, is to put a bookmark in where you think the pass-fail mark should be. And you do that based on the questions sorted by their level of difficulty. So I won't go into a lot more detail here because you don't use this, but I'd be happy to answer any questions about it if you do.
So actually, the IRT comes only to find the difficulty of the questions. Thereafter, it's a group process. So when different people put different bookmarks, you have to decide then where is the group bookmark is, right?
Exactly. So it ends up being just exactly like Angoff or Ebel, because what you do is you ask everybody to talk about where they put their bookmark and why they put it there. You have a conversation in the group, and the group at the end of the day is free to change where the bookmark is. So they can do that, move it around. And at the end of the day, you average their results to end up with a cutting score. So it's just like the other methods. It's just that it suits IRT particularly, item response theory particularly well. Any other questions about this? All right, so let's summarize for this class of methods. These are methods where judgments are made about the items. So that's Angoff, Ebel, and bookmark. So the advantages of these methods are that they focus attention on item content, and they're relatively easy to use. There's huge amount of research on all of these methods, especially Angoff. There are literally hundreds of papers around Angoff, and they're used frequently in high stakes testing situations. So if you're using one of these methods, one of the advantages is that if someone challenges the credibility of the standard, at least you can say, look, we're using a method that other people have used. There's this whole body of research about it, around it, and that's how we base our standard settings. Downside is that the concept of a borderline group is foreign to judges sometimes. Judges sort of feel like they're picking numbers out of the air when they talk about what the borderline group is. So this is one of the real challenges for the methods. The other thing is it can be tedious. There's some ways to make these methods shorter. There are a whole bunch of variations on things you can use, but the bottom line is you're going to be spending a considerable amount of time to do this. So are there any questions about this sort of class of methods before we move on to a different class?
John, I have one question.
Yeah.
When we selecting the panelist, can it be the examiners? I mean, in Sri Lankan universities, let's say we have 6 examinees who contribute to set the questions, and can they contribute as a panelist?
So yes and no. So I've been in situations where it is not good to have the person who writes the question in the room with the people who are actually judging the results of the students, because they're very devoted. My experience has been, when you write a question, you're devoted to it. Okay, and you may not be able to see all the flaws in question that other people can see. So to the degree possible, it's nice to separate those two things out a little bit. The other thing that sometimes happens in the group are that the power dynamics can sometimes shift around based on this. So to the degree that you can keep those two groups separate, I think you're probably a little better off. Again, this is one of the times, if you're worried about that using actual student performance data on the items to inform the judgments of the experts can be a really positive thing, because it allows a sense of reality that might not otherwise exist in a situation if you don't know how students actually performed.
Okay, thank you.
Sure. Any other questions about these? All right. So let's talk about a sort of second group of methods where the judgment, instead of focusing on items, focuses on the performance of examinees. And one of the first methods of this kind that we'll talk about a couple of them, is the up and down method. So you select the judges, you discuss the purpose of the test and the nature of the examinees, just as you do with all the other methods. But then what you need to do before you go into the meeting, if you're running the meeting, what you need to do is you need to select the actual test papers of a group of examinees that you think are somewhere in the region of the cutting score. And so what you need to do is, one by one, give the entire examination to the group of judges. And they need to reach consensus about whether this is a passing performance or a failing performance. And let me go to the picture, because I think it makes a little more sense to describe it this way. So this is a test with 80 or 90 items on it, 100 items on it, something like that. And what I did is, I'm running the meeting. And so I take the first book that I think the cutting score should be somewhere in the 70 to 80 or 65 to 85 range. And so I have a stack of books right there in order that I start. And so the first book I pull out, the trainee, the examinee has a score of 74. So that's you see at the bottom of the number of trainees, number one had a score of 74. And I gave it to the group. The group looked through the book and they reached a consensus. And the consensus on this particular student was that the student passed. So what I did then is I went and took a second book out. The second book being an examinee with a score of 72. And I gave it to the group. The group looked at it, made judgments about it. They said, this is a pass. So then I went and I got a 70. And I gave it to the group and they said, pass again. So then I got a 68 and I gave it to the group and they said, pass again. And then I got a 66 and gave it to the group and they said, fail. So what I did is I went back and I got another examinee, but this time with a higher score, 68. And they said, pass. So I got a 70 and they said, fail. So I got a 68 and then a 66. So the bottom line is you're going back and forth here until you get close, where folks get close to each other. And the cutting score in this particular instance would probably be around 66. So that's why it's called the up and down method. You're giving them a book, they're making a judgment, you're picking the next book that has a different score, up or down, depending on that decision. And then when they get into a sort of restricted range, you feel comfortable with them just sort of going up and down in a close range, you stop the exercise and you set the standard there. Do you have any questions about this? This is a little bit different than the ones we talked about before.
John, look here, what sort of like exams would be like, what is the assessment method that you would use this for? Is it for an essay type of paper or?
Yeah, you could use this for an essay. You could use it for an MCQ exam. You could use it for any examination of that kind. Obviously, when you're looking through an MCQ paper, you're looking at a lot of questions.
Yeah.
So this could be, you know, that's one of the disadvantages of these methods in general. And nonetheless, at the end of the day, you can make some judgments based on these. And it's a different kind of judgment because you're taking the performance of the examinee as a whole, not on an item by item basis. Are there other questions about this? Yeah.
Ashwini here.
Yeah.
As you mentioned, if for an MCQ, we would need to go through a lot of papers, is it okay to sample either randomly or from thirds based on the scores?
Yes, you could do that. And what we're going to talk about next is called the up and down method. And in fact, you would start with more of that kind of a strategy going into it. The advantage of this is that really you only have to, excuse me, you only have to judge a limited number of papers. You'll see when we talk about the contrasting groups method that you have to judge many more papers when you do that. So yes. So the answer to your question is yes, but the advantage of this is you have a good sense of where you think the cutting score is going to be. So you limit the number of papers that you're going to be looking through based on this method, even though each individual paper might be pretty long.
Okay, thanks.
Sure, good question. Anything else? All right. So let's talk about contrasting groups. This has been used actually quite a bit, and we'll talk a little bit about methods that are based on this, especially with OSCEs. But as was just said, in this setup, you're going to be selecting a random sample of examinees or something like a random sample. And you're going to be given the judges the individual test booklets of examinees, and they're going to make judgments about whether there's a pass or a fail on each of these. So let me take you to the picture because, again, I think this is easier. So we went through, this is a paper with an MCQ exam with 11 questions on it. And we gave the papers to the judges. The judges categorized them as each one as pass or fail. And the first thing you do are you graph those who the judges thought failed. So as you can see in this, there was one poor student who got a 0 on the exam, and the judges thought that that person failed. And there were 3 people who got a 1 on the exam, and the judges thought that they failed. And there were 5 people with 2s that the judges looked at, and the judges thought that they failed, and so on. And you see by the time you get up to 7, nobody fails anymore. So the first thing you do are you graph the scores of the group of students who failed the examination. You then go back through that same set of papers and you graph the scores of the students who passed. So for example, no student who had a score of 0, 1, 2, or 3 passed the examination. But in terms of 4, there were 2 students who they thought passed. There were 2 students with 5s who they thought passed. There were 3 students with 6, 3 students with 8, 7, 8, and there was 1 student with 9 who passed as well. So now you have these 2 graphs. You have the graph of the students who failed, and you have the graph of the students who passed. And what you do then is you pick the pass-fail standard in one of 3 ways. First way is maybe you want to minimize the false positives out of the examination. And otherwise, in other words, what you want to do is you want to give the benefit of the doubt to the students. So what you're saying is that a 3, because a 3 was the lowest score that a passing student got, that group should, that's where the passing score should be. Second option is to go, and the one most people use, is to go in the area with the least overlap. So it's where the 2 distributions overlap least, and the other one is to minimize false positives. So in this particular instance, what you're doing is you're saying, I don't care, what I care about is, for example, protecting patients. And so I want to minimize the number of false positive decisions that I'm making. And so I choose a place in the distribution where no one who is judged as failing passes the examination. Does this make sense? Questions? Concerns? You're stunned.
Okay, John, I'll ask the question.
Okay.
What if the 2 graphs don't meet each other?
Well, then you just put it, you put the cutting score in the middle. That's the perfect place to be, because on your exam, all the people who you judged as failed will be below a point, and all the people you judged as pass will be above that point. So it's the perfect situation if there's no overlap.
And then if you have, let's say, 2 question difference between the 2 graphs, the 2 ends of the 2 graphs, then you take the middle of it.
Exactly. They really, actually, you could choose anyone, because whichever one you choose is going to have the same result.
Yeah.
It'll pass everybody who passes and fail everybody who fails. But choosing the middle of it is reasonable.
How many questions, how many papers should you be sampling for the pass and the fail?
That's one of the real challenges of this method, and because you'd like to be able to define the tails of both distributions reasonably well, and that's where the fewest people are. So it really is challenging, and it's one of the real downsides. When you do an ANGOF, for example, with a 200 or 300 item test, it's a tedious process. Likewise here, if you've got a whole bunch of examinees and the test is really good at separating them, it's challenging to find exactly the right group. So there really is no number around this. Again, you can look at the reliability of the judgments of the group as one way to get to this, but that's really a challenging reason to apply these.
Thank you. So you will not even suggest a number, right?
No, I wouldn't even suggest a number, because it'll depend on what those distributions look like.
Mm-hmm.
And in fact, one of the things you can do, as with both of the methods, up and down in this, is that you can decide during the process when you think you have enough to call the question. So if the two distributions are overlapping a bunch, you might do more. And if they tend to be more separated, you can do fewer. So I wouldn't make that judgment in advance. I would let it emerge from the data.
Okay, thank you.
Okay. All right. So the advantages of these methods are that, in my view, the judges are actually pretty comfortable making these kinds of judgments. They're very used to looking at a paper, coming at the end of the day, looking at all the questions and saying, you know, this is good enough or this isn't good enough. So they're comfortable with this, unlike the borderline group piece where there's some discomfort. Nice thing about this is that the methods inform the judgments of the experts with the actual test performance of the examinees. You have to look at how they actually did in order to reach a judgment. And the other advantage of this, especially with contrasting groups, is that it allows you to manipulate the number of false positives and false negatives that you care about. So depending on your situation, if you're trying to protect patients, if you're giving the benefit of the doubt to students, contrasting groups allows you to do that in a rational way. Disadvantages you've already pointed out. I mean, these are really time consuming. It's really difficult to review the entire test and make some unbiased judgments about the skills of the examinees. You have to do this for the fairly large number of test takers to create reliable passing scores. And at the end of the day, choosing whether you want to minimize false positives or false negatives, or you want to choose the point of least overlap, can be a little subjective, although these processes are subjective generally. So there's some of the strengths and weaknesses of these. Any questions about them? All right, so let's talk about compromise methods. So the compromise methods were designed for situations where you want to compromise between relative standards and absolute standards. So again, you do this as the same way as with all the methods. You collect the judges, you select them, you discuss the purpose of the test, you review the test in detail, and so on. But you basically ask the judges 4 questions. What's the minimum acceptable cut score? What's the maximum acceptable cut score? What's the minimum acceptable fail rate? And what's the maximum acceptable fail rate? So again, as with Angoff, you ask each judge to make a decision about this. They announce it, and they have the opportunity to have a conversation and then to change their minds and choose whatever they want. So again, I think the picture is better than the words. So in this particular example, on the vertical axis, you have the fail rate, and on the bottom, you have the % correct items on the test. So in this particular example, we asked the judges, let's start with fail rate. What's the highest fail rate you're willing to accept on this examination? And this particular group of judges said 30%. That's the highest I'm willing to accept. And so you see a line across the graph at 30%. They also asked the judges, what's the minimum acceptable fail rate? And the judges said 10%, you know, and so there's a line at 10%. So basically what they said is, if more than 30% of the people fail this examination, I'm going to be really uncomfortable. And they also said, if fewer than 10% fail, I'm going to be really uncomfortable. So what you've done is you've identified sort of the area in which they're going to tolerate pass-fail results. Let's shift over to the % correct side. So you say to the judges, what's the minimum you're willing to tolerate, an examinee answer incorrectly on this examination. And the judges said 70%. Okay. If someone answers less than 70% of the questions right on this test, they have to fail. I mean, we just can't have it any other way. So you see a line up from 70%. And they asked the other side of that, and that is, what's the maximum you're going to be willing to tolerate? And they said 90%. You know, if somebody gets 90% of the questions right on this test, they need to pass regardless. And so you see the line up at 90%. And what those two lines end up doing is identifying a box. And basically the diagonal line along that box is a compromise between those two. And what you end up doing is graphing examinee performance, which is that sort of ogive, cumulative ogive that runs through the box. So in this particular exam, you would probably choose 75% items, 75% correct as the cutting score, or you could say the bottom 20%. Both of those would produce exactly the same results. So what this is a method for compromising between relative standards, the most you're willing to accept politically, and the most and least you're willing to accept, as well as the content, the absolute standards. I'll stop here and ask if there are any questions about this.
On Alokya, when do you ask the judges to make this call, the fail rates and the percentage correct rate? That is after going through all the items of the exam. Let's say if it's an MCQ paper, they go through all the items and say that is, they feel that this would be the fail rates and this is the percentage correct, is it?
Yeah, so you're looking at the paper as a whole. You don't need to give them any data. You just have them look at the paper as a whole, not any particular examinee. And you ask them to make the 4 judgments that we just talked about.
Right.
So it's a very efficient method.
This is good for a SCQ paper or a essay paper, isn't it? To look at the paper.
I'm sorry, you broke up a little bit. I didn't quite hear your question.
Yeah, ideal method for our short answer questions or structured essay papers.
You could use it. You could use it for almost for any examination because you're asking the same 4 questions regardless of the exam. So it doesn't really matter what the questions are. Other questions about this?
So these values are averages of the judges, all the judges, like your 10% and 30% fail rates are the averages that the judges give, is it? It's we have 5 judges.
I'm sorry, I'm not getting your question.
So if you have 5 judges,
yeah.
So this is the average, isn't it? All these lines are averages of all the judges.
Yes, exactly. So the 5, if you had 5 judges, the 5 judges said on average, we can tolerate at best a 10% fail rate. This 5 judges also said we cannot tolerate anything more than a 30% pass rate. So that's where those lines came from.
Thank you.
So it's an average of the 5 judges, their answers to each of the 4 questions.
Thank you.
Any other questions about this? All right. So the advantage of this is it's obviously easy to implement. You know, you can get people to sit down and make these judgments in a very straightforward way. Educators are very comfortable with these kinds of decisions, so there's no problem with that. So they're good from that perspective. Disadvantages, there are some times when the cut score may not be in the area defined by the judge's estimates because the examination was harder perhaps than the judges estimated that it would be, or they have unrealistic expectations. So one of the disadvantages of this is that the cut score may not be in the area defined by the judges. Second thing is because it incorporates information about what proportion of examinees should be passing, relative standard, it's not the first choice in most high stakes testing situations. It's a great fallback position. So many times in practice, we did Angoff method. We did the Angoff method, but we also asked the judges those 4 questions from the compromise method. And if the results appeared to be totally unrealistic, we used the compromise method as a fallback for it. So in high stakes situations, this isn't ideal, but from, in a local institution, local medical school, this is not an unreasonable way to approach things because it's relatively efficient and people can make judgments quickly and it tends to be relatively credible. There's some literature about it. Okay. Any questions about these before I move on? Yes.
Yes, Prof.
Can I
Joe.
ask? Yeah. John, now I want to ask you a question. Now, this is a practical question. Now, most of our universities in the exams, they are using multiple tools. They are using MCQs, structured essay questions, OSCEs, the various methods. So when you are using different methods, so how can you standard set the final mark?
Okay,
because,
so yeah, it's a really good question, but I'm going to have to ask you a question back. How do you combine those scores on the examination to reach a total mark?
Yes. At the moment, what we are doing is that we are taking certain percentages and the student who has got more than 50, we pass.
Right, but so let's take an example where you have some multiple choice questions and you also have some short answer questions. How would you combine the scores on those examinations right now to get a total score for the examinee?
So, sorry, suppose if you are giving, so hypothetically, if you take, if you are giving 50% for the MCQs, multiple choice, and 50% for the essay, structured essay type of questions, so you take 50%, and then you add and make it 100%. So that is, I think the others agree that that is what we usually do.
So all you do, let's take the Angoff method because that's pretty straightforward. So what you would have is for each item, you would have a proportion of the borderline group, an average proportion of the borderline group that would get that item right. If the question is weighted, you multiply it by the weight of that question and you add them up and you'll get the cutting score.
Right. So that means you are applying the standard setting for 2 different segments of the exam.
Yeah. Yes.
Right.
Well, you're doing it in one because you're only going to make one decision, right?
Yes.
And so if you have an Angoff estimate, you're going to treat that Angoff estimate exactly the same way you treat the scores of examinees. If one question is worth 5 points, you'll multiply the Angoff estimate by 5. If another item is worth 1 point, you'll multiply the Angoff estimate by 1 point. You'll sum them all up, and that will give you a cutting score on the same scale as the full exam.
Okay, got it. Thank you, Prof. Thank you.
Other questions about this? All right. So how does all this apply to clinical exams, OSCEs, basically? Excuse me. Basically, the methods apply very directly all of them to OSCE exams, some more painfully than others because it takes a lot more work, but they all apply the same. So you could do a contrast in groups with all the OSCEs. You could do an ANGOF for all the items. You could use the compromise method, applies directly to an OSCE examination as well. So this would be an example of applying an ANGOF to an OSCE checklist. So this is a case, and the student had a task, and basically there's a student's, what you see on this are proportion of correct for all the students. So did the student ask about the sore on my ankle? 92% of the students did. What you need to do in the ANGOF is basically what proportion of a borderline group of examinees would have asked about the sore on the ankle, or what proportion of the borderline group for the second item would have asked about the stroke, or the third item, what proportion of the borderline group should have asked about my living situation. So it's exactly the same as with the ANGOF method. So it's identical. It's just that it's a lot more work, because if you have to do this for a whole checklist, it takes a lot of effort. So are there any questions about this before I move on to another method? Hearing no objections, there are a series of variations when the OSCE is actually observed. In many places where OSCEs are used, and I'm not sure what happens in your setting, and maybe I ought to shut up and ask the question, is there when you do an OSCE, is there an examiner in the room with the trainee?
Some stations are manned and some stations are unmanned stations, John.
Okay. Well, where there is someone in the room, you can use that to get estimates that you wouldn't otherwise have. Let me talk about the most popular of those, which is the borderline group method. So what happens is that when there's an examiner in the station, in addition to filling out a checklist, the examiner is asked a question at the end, one overall question. And that question might be, what I'd like you to do is I'd like you to rate this performance of this student. Is it fail? Is it borderline? Is it sufficient? Is it good? Or is it excellent? So that at the end of each station, the examiner will make that judgment about the trainee's performance. And you can then use that with regression to turn it into a cutting score. So at the bottom of this graph, you'll see the ratings, those 5 ratings that I just mentioned. So one is, let me go back and remind myself, 1 is fail, 2 is borderline, 3 is sufficient, and so on up to excellent. So every student will also have a checklist score. So let's take the example where all the examiners where the trainee was rated as 1, unsatisfactory. And if you look at their checklist scores in this little example, one of those trainees had a score of 30, one had a checklist score of 40, and a third had a checklist score of 50. So you graph that. You then look at the trainees who were rated 2 by the examiners. And in this hypothetical example, there were 4 of them. One had a checklist score of 55, 160, 165, and 170. You then go up to a rating of 3, which is borderline. And you see there were 5 there, 160, 165, 170, 175, 180, and so on. So you graph that for each of the 5 ratings, and you apply a regression to it. You calculate the line of best fit. And in this particular instance, you see the rating of 3, which is borderline. There's a score of about 70 where that solid blue line crosses the checklist score. So that 70 becomes the cutting score for everyone. Does this make sense? It's a little more complicated than the other methods are.
John, I thought 2 was the borderline score. 1 was failed, 2 was borderline, 3 was sufficient.
Oh, you're right. I'm sorry. So yes, so you might choose 2 in that instance. So if you want to say borderline, so the cutting score would be 58. You're absolutely right. Thanks. Good catch.
Anybody above that score would pass the station, correct?
That is correct.
Thank you.
Any questions about this? So the advantage of this obviously is that you have examiners in the room. They're making judgments as you go along. So this doesn't require any additional work. All you have to do is do the regression. And that produces a borderline kind of performance for you. The other thing is you can change the ratings. You could have the ratings be unsatisfactory and satisfactory, and do a contrast in groups with the results. So you have lots of possibilities here, and all of them add to the efficiency of the process. This is the method that's used most often around the world with OSCEs because it is relatively efficient, and it's been used in some high stakes exams. When the MCC had OSCEs, this is what they used and what a variety of other high stakes testing organizations have used with OSCEs. Yeah, question.
Yeah, Joe again here. Now, the examiners are not, are they supposed to adapt the marks in the checklist when they are giving the global rating?
No, they should be done the checklist. Obviously, the checklist is going to influence their judgments because they've seen what the examinee did or did not do as part of the process. But they, in addition, need to make a judgment overall. And that makes some sense from a perspective because not all the items on the checklist are of equal importance. There might be some items that the judge thinks are particularly important. And if you miss it, you know, these few items are a bad thing. So I'm going to rate the trainee down for that. So it allows them to be more synthetic in their judgments and not to be so slavishly devoted to the checklist and what's on it.
Okay, thank you.
Sure. Any other questions?
John, do you recommend the judges, the examiners, before they examine, discussing the characteristics of the borderline candidate before the exam?
Yes. So as part of the training that you would normally do for OSCE examiners, this ought to be a piece of that conversation. So I'm sure as you train your examiners to do this, you're going to be doing some of that anyway. So this should be part of that conversation.
Thank you.
There is an advantage here. One way to think about each of the examiners is as a standard setting judge as well. One of the advantages of this is that as the number of examiners you have increase, it means you have a bunch of standard setters engaged as well. So if you were to have, I don't know, a 10, 15 station OSCE, that would mean that you have 10 or 15 judges making decisions about the standard as well. And so that's a sort of a positive way to increase the reliability of that standard that's derived.
John, what is your, sorry.
I'll go later.
John, what is your take on the number of examinees in this situation? I think if the number of examinees are going to be a few, there can be an issue, right?
Yeah. If you only have a few examinees, then the estimates of the regression equation are going to be funny. So you have to do this with a number of examinees.
John Aloke, can I ask a question?
Sure.
In our setup, we have the rating scale, but we use borderline as a borderline failure. So our 1 to 5 scale goes as fail, borderline fail, pass, good pass, and excellent. So what should be our level, like what should we select as the cutoff scope? Is it borderline fail or clear pass?
Well, see, that's why I don't like using those anchors, because if you want to make a judgment about who should pass or fail, it should be based on the borderline examinees. So what I think I might do in that instance is I might adjust my rating scale a little bit and make sure that there was a borderline in there. If you have borderline fail, that means fail in my view, because you used the word fail in there. Borderline is kind of a better word because it's neither pass nor fail. And so choosing the average of that group makes sense. Borderline fail means that they fail, but they're close.
Unfortunately, the PGIM has these defined close marking schemes. So we might have to probably address that issue with the PGIM, because all the exams, the post-graduate exams, use the close marking scale with this 1 to 5.
Yeah, so maybe what you want to do is think about the passing score being just above the borderline fail.
So maybe 2.5 or maybe.
Yeah, exactly.
Okay, thank you.
Sure.
John, is it incorrect to say that if Prof. Aloka can take pass as the category, will that be good? Because then it's safer, because it's a high stake exam. They have done postgraduate degrees and they're just about to become consultants like. So if we take pass as the cutoff, will that be safer? Because then we actually eliminate all the borderline passes as well.
So yeah,
you're on the more positive side. Yeah.
Yeah, that's a good question. What you're doing is, in essence, you're trying to minimize the number of false positives when you do that. What I would encourage you to do is take those data and do a little bit of a contrasting groups kind of thing with it. And that might be a way to achieve the results that you're looking for. Part of the problem is that you're going to end up with it from a credibility perspective, is that if you have a trainee who has passes on a variety of different stations, you may undermine the credibility of the examination to some degree. And then afterwards, they send people home with the items to finish them at home. That's a modification. So there are literally lots of little modifications of the ANGOP method, and you should feel free to make those modifications in your own setting. If you think there's something that works for you, it's great. You ought to try it. When I was working for the board, it was really expensive to get the experts together in a room. There was no Zoom in those days. To get experts together in a room and to keep them there for several hours doing an ANGOF. And so we did a little study where we had some people do ANGOF ratings before they came to the meeting. Everybody did them together in the meeting, and then we gave them some items to take home. And what we found is that the items that they got to take home, they did exactly the same, or they did similar. Their standards were the same as the ones after the meeting. So rather than getting people together for a day or two in order to do this, we modified the process so that we got them together for a couple hours. They did 30 items, and then we gave them the rest of the items on the examination to do at home by themselves and send in their ratings, and the results were very reasonable. So there are like dozens of modifications on the methods, dozens on Angoff in particular. And so you need to fit it into your own environment and make whatever changes you need to make. There's nothing sacred about any of these methods.
Thank you very much.
Sure.
John, one argument that people bring forward when we try to introduce standard setting methods is that when we know that pass mark is 50 or 40 or whatever, it's the set mark, we internally adjust ourselves, our papers, our stations, whatever, to meet that criteria. Maybe 50% of the items are set at that level, and that's maybe a false argument that they come forward with. What is your opinion on that?
That's a really good question, and I think that's actually the reason to do standard setting, because what you end up doing when in that situation, and it's not you alone, this is everywhere in the world where this is done, is that you naturally modify the content of the test to suit the standard that's already been set. So just as you said, you might, if the standard is 50%, you make sure that your items are focused around 50%. So you lose perspective on the content. You know, there are items that are important that should be on the examination, regardless of whether everybody or most people get it right or not. Likewise, there are items that might be very hard that ought to be on the examination, regardless of how many people get them right. So what standard setting does is it allows you, it frees you up to write an examination to a blueprint in the content that's true to the domain and to the importance of particular content areas, regardless of how easy or difficult it is. And then you can treat that, the ease or difficulty, when you set the standard. So I think there's a really good argument for standards. One of the best arguments for standard setting is that the current system with a fixed standard forces you to change the content of the test. And instead, I think we would all be better off if the content of the test came from your judgment about the importance of the content and not from some artificial number.
Thank you.
I feel strongly about that if you didn't notice.
Joe here again. Another question which is important to our sitting. Now, most of the universities, I think Madhav and Govinda will agree, our multiple choice questions are true false type, and each question has about 5 responses. So in that situation, can you use Angoff method to standard set?
Yes. So you have the so-called multiple true false questions.
Yes.
With kind of a stem and 5 options, and you have to say true or
5
false.
options are there. Yeah.
Yeah, so you have 2 options there. One is you can apply the Angoff at each individual item within the set.
Right.
Okay. So you might say that for item 1, my estimate is that 60% of the borderline group would get this right. And item 2 is 60 and so on. So that's one method. It's a little more, it's pretty time intensive because you have to do each of the items, each of the true false responses within the set. The other option is to do the set as a whole and say, out of the 5 questions, how many will the borderline student answer correctly? Okay, so you can switch the question around a little bit. That's probably a little more efficient. But again, it gets you to exactly the same place. That makes sense?
How many percentage of students borderline students will answer all 5 correct, or how many correct?
No. So there are 2 different questions. The first question is what proportion of the board, let's take each individual item under the stem.
Right.
So each individual item, then you say what proportion of the borderline group would get this item right. And let's say that the judges said 50% for all of them. So what you would say is 2.5 overall, right?
Right. Right.
Another way to do it is to say, how many of these 5 items, how many number will the borderline trainee get right? And you might say 3 out of the 5. I might say 2, and at the end of the day, the average will be 2.5. So the question you're asking at each individual item is what proportion of the borderline group will get that item right. For the whole set, you're asking how many. Make sense?
Yeah, got it. Thank you.
Sure.